Welcome to the Performance Prescription Lab podcast and to our special Paris 2024 series. The Paris 2024 Games is a sporting spectacle like no other. It turns ordinary athletes into national heroes and generational talents into legends. It's where the best athletes in the world push themselves to the very limit of what is humanly possible, chasing athletic brilliance, fair play, and the world united by sport. Over the following weeks, we will be celebrating the Paris Olympics and Paralympics with special episodes focused on elite athletes, clean sports, and the fascinating world of the Paris 2024 Games. I'm Nilhan.
And I'm Jessica. Today, we're tackling the crucial topic for athletes and healthcare providers, especially with the Paris 2024 Olympics and Paralympics on the horizon. Today, we're talking about therapeutic use exemptions, sometimes also called TUEs. One of the most common misconceptions that I hear, or we probably both hear from athletes, is that since they have a prescription from their doctor, they believe that it's okay to use that medication.
That's not okay, Jessica. TUEs are essential for athletes who need to use medications that are on the banned substances list of WADA due to a legitimate medical condition. Understanding how TUEs work and the process involved is critical for athletes and also their support teams.
Today, we'll explain what a TUE is, why it's important, and what it means specifically for athletes heading to Paris. We'll also discuss the application process, many pitfalls, and real-world examples to highlight the impact of TUEs on an athlete's career.
Whether you're an athlete, a coach, or a healthcare professional, stay tuned as we explore the ins and outs of therapeutic use exemptions and their significance in sports. A little bit of history from me. TUEs have been available to Olympic athletes since the 1980s. The need arose when the IOC, International Olympic Committee, prohibited several classes of drugs used in common medicines such as diuretics, beta blockers, and corticosteroids. A TUE can be for a specific prohibited substance in certain dosages with a limited period of validity, permitting the athlete to take the defined medication while competing without registering a doping offense. Not only can TUEs be granted for using prohibited substances, but also prohibited methods may be medically necessary for some athletes. The use of TUEs is carefully monitored to avoid any abuse or manipulation. So here is a short history background from me. We'll do the traditional, and Jess is going to give us a quick 101 on TUEs. Go ahead, Jess.
Yeah. So a TUE is a certificate granted by an anti-doping agency. Athletes do not apply to the World Anti-Doping Agency, also called as WADA, for a TUE. WADA only outlines the rules, the process, the hearings and appeals and audits of the TUE application. So if you're a national level athlete, you submit your application to your national anti-doping organization, oftentimes called NATO, NADO. If you are an international athlete, you must apply to your international federation, and it's also recommended that you check with your national anti-doping agency before applying for a TUE. So this application is submitted as soon as the athlete is prescribed the prohibited substance or method. It's reviewed, and then it's approved by a TUE committee. This gives athletes the permission to take the medication or use the method without the risk of being sanctioned. Physicians and prescribers are responsible for completing the TUE form and providing the required supporting documents. Nilhan, under what conditions and which would a TUE be granted for an athlete?
A prohibited substance or method in question is needed to treat a diagnosed medical condition supported by relevant clinical evidence. So this is the first criteria. Then the therapeutic use of the prohibited substance or the method will not, on the balance of probabilities, produce any additional enhancement of performance beyond athlete getting back to his or her normal medical state. So no performance enhancement. And the next one is that the prohibited substance and prohibited method should be indicated to treat the medical condition, and there is no reasonable permitted therapeutic alternative. So there are no other therapeutic choices. And the last category, criteria, is recently added to the list, and that the necessity for the use of the prohibited substance or the prohibited method is not a consequence, wholly or in part, of the prior use of a substance or method which was prohibited at the time of such use. So if you have a doping violation and then to treat that, you couldn't get a TUE for another prohibited substance or a method. So a TUE can only be granted when these criteria are met. Just while we are recording this episode, many athletes are heading to Paris, which is really exciting. And in 10 days from now, the competitions will kick off. Each of these different periods are regulated differently according to WADA for prohibited substance and method. So can you give us a little more context about what would happen prior to Paris, what would happen at Paris?
Yeah, so TUEs can be given for specific situations, as there are three different ways that a substance can be banned on the prohibited list. So the list is divided into three categories. So there are substances and methods that are always prohibited, meaning in and out of competition, you're not allowed to use these medications. Then there are specific substances and methods that are prohibited only during competition. And that is a very set period of round when you are competing. And then there are methods and substances that are prohibited only in certain sports. So for example, they permit alcohol use in any type of like motorcycle or racing events, because obviously we know the impacts of alcohol on driving. So that would be an example of when something was prohibited only in a specific sport.
Mm-hmm.
Nilham, can you dive a little bit more into this, like in competition, since we are heading into Paris, and how could this apply to any athletes competing or being drug tested about this in competition?
So there is an innovation for Paris 2024 Games because the IOC has delegated the management of TUEs and the anti-doping process as a whole to the International Testing Agency, ITA. So all Paris 2024 participants are bound to the anti-doping rules, particularly their provisions related to TUEs, which will be managed by ITA. Very importantly, TUEs granted in the context of the games are only valid for the period of the games. Therefore, TUEs for chronic conditions such as ADHD or diabetes should be processed by your national anti-doping organization, NADOs, or your international federation in advance of the games. So we really hope that athletes have adhered to this before arriving to Paris. And for substances prohibited in competition only, the athletes should have applied for a TUE at least 30 days before the next competition, unless one of the exceptions of a retroactive TUE apply. We are going to explain that in a while. If you already have a TUE granted by your NADO or your international federation, your TUE will undergo the recognition process for the period of the games. So ITA is going to handle that recognition process as well. And all athletes participating in the Olympic Games should apply as a first resort to the ITA's TUE office, which is going to be located in the polyclinic of the Olympic/Paralympic Village. And ITA strictly recommends booking an appointment before heading to the TUE office.
Perfect. Nilham, you mentioned retroactive TUEs. So can we just pause for a split second and review what that means and why might an athlete need one in case someone's not familiar to what happens or retroactive TUE?
Yeah, there would be cases where an athlete needs to receive the prohibited substance or the method without getting a TUE, and these conditions are several and identified by WADA as well. So first of all, if you require an emergency urgent treatment of a medical condition, especially in a hospital setting, you may apply for a retroactive TUE for a prohibited substance or a method. The next one is that if there would be insufficient time, opportunity, or other exceptional circumstances that prevented the athlete to submit a TUE application or having it evaluated before getting tested, then you can also apply for retroactive TUE. And the next one is, as per the IOC anti-doping rules, the athlete was not permitted or required to apply in advance for a TUE, and then this is when you can apply for a retroactive TUE. And finally, if the athlete is tested positive after using a substance out of competition that was only prohibited in competition, this is also where you can apply for a retroactive TUE. An example can be given for this last criteria is glucocorticoids, because they have washout periods and they are prohibited in competition. And if somehow you tested positive for a systematic use of a glucocorticoid, you can apply for a retroactive TUE. An important note, using a prohibited substance or method without TUE could result in an anti-doping violation. Jess, why don't you tell our athletes and also healthcare providers how athletes can apply for a TUE in Paris? A little bit more detail about the ITA process.
So the first step would be to fill in the TUE application form, sign it, and have it signed by your physician. Then you're going to need to gather all the supporting medical documentation. And I find that WADA is really helpful here because they do have checklists to support the physician in filling out a complete TUE. Then you have two options. You have one where you can book an appointment and provide the form and the supporting document through the online portal that will be opened during the appointment, or you can submit the form and the supporting documentation directly to Adams if you are familiar with this process. You can also call ITA should you require support. There is a French phone number that will be available during the period of the games, and it will help you and they'll also help you in person at the TUE office, like we talked about, that was in the polyclinic of the Olympic Village. So they do recommend making an appointment in advance for these services. Nilham, when athletes and healthcare providers put together a TUE application for submission, what are some of the stuff that's required for submission? So we said we had to put together a packet. Yeah. What all is required in this packet?
Your TUE application must be submitted in a legible form using capital letters or typing. This is by default in any formal application. And then you should include a medical file. Attached to a medical file to your application, which must include a comprehensive medical history, including documentation from the original diagnosing physician or prescriber, where possible, and then results of all examinations, lab investigations, and imaging studies relevant to the application. Any cost incurred by the athlete in making the TUE application and in supplementing it is required by ITA's Therapeutic Use Exemption Committee. These are the responsibility of the athletes. So athletes will bear the costs, and any TUE application that is not complete or legible will not be dealt with, will be returned for completion and resubmission. To assist you and your prescriber, your physician, in providing the correct medical documentation, there are checklists you've mentioned, Jess. WADA have these checklists for TUE applications to guide and support the process. And also it provides some medical information to support the decisions of the Therapeutic Use Exemption Committees of ITA. So these checklists are very, very useful for athletes and the physicians. So it's important to keep a complete copy of the TUE application form and all medical information submitted to support your application, and also keep a proof that it has been sent, because I can imagine that this office, the TUE office, will be really busy during the games. It is the athletes and the physician's decision and responsibility to participate in an event without a prospective TUE. For example, untimely timing, in the case if you have chronic injury or disease, or you have ongoing pain for several days, but sending an application for prohibited treatment only on the eve of a competition. So there would be cases that you can go for competing without a TUE, but of course the ITA couldn't guarantee that you would receive an approval.
Yeah, Nilham, I do have a question. Like, what happens when a treatment needs to be modified based on what they, on a already provided TUE? So what happens with a modification?
Yeah. So if an athlete requires a different dosage, frequency, route, or duration of administration, it's important to contact the organization that have granted your TUE. as you may be required to apply for a new TUE. So any adjustment on the existing TUE needs to be checked in with the organization. Same substances and dosages, for example, insulin, are often modified during treatment, and these possible fluctuations should be mentioned by the treating physician in the TUE application and would usually be accepted by the ITA's Therapeutic Use Exemption Committee. So it really
Oh,
depends on the clinical treatment
situation. Yeah.
being
I
used
kind of
for.
figured that, but definitely something to think about as an athlete if your treatment does require modification. I have another question, and this one is probably what a lot of athletes think, and probably a question in people's heads is like, so what are your thoughts, or honestly, is there any research out there showing that athletes with a TUE win more medals, perform better? Is there any studies kind of showing that they do have a heads up or they don't, or it levels the playing field?
Yeah, this is a question that probably struck many people's minds. And there was one study that used IOCs and WADA's data to identify whether athletes competing with a TUE in Olympic Games, they have a better advantage in winning an Olympic medal. So
Okay.
they looked at the Olympic Games, 5 Olympic Games between 2008 to 2018. And according to this study, they've identified that there are top sports that where athletes use TUEs. So skiing had the most TUEs of all sports, which is expected due to the high volumes of cold air inhaled and the subsequent conditions. And then
Makes sense.
during the games from 2010 and 2018, there were more than 20,000 competitions and 2,060 medals were awarded, according to the study. And they identified that athletes competed with a TUE in 0.9% of the competitions. There were 21 medals won by athletes with a TUE amongst 2,000 medals won, and the number of athletes competing with valid TUEs at the games were less than 1%. So if you look at the study suggests that there was no meaningful association between being granted a TUE and the likelihood of winning a medal. And also we can look at this perspective. Athletes from countries with greater resources, for example, they used the GDP and team size, are more likely to be granted TUEs and to win medals. So this is something to look for in the context of health equity. And if we look at the study, we can say that sports physicians may reassure their athletes that the TUE process is well controlled and regulated, and there is no rampant use of TUEs in elite sport. There is no unfair advantage for those athletes with diagnosed medical conditions taking a prohibited substance. If an athlete or healthcare provider wanted to check on a medication, what is a good resource, Jess?
Yeah, so my go-to is Global DRO. Global DRO is what most people say. It's an easy online resource. They also have a mobile enhanced resource for searching basically prohibited substances. And it's really easy to use. So you go to the website globaldro.com and you select your nationality or country of origin. Then you select your user type. If you're athlete, a provider, what are you? What sport? The nation that you purchase it in, and then you just type in the brand name of the drug or the active ingredient. You have to accept the terms and conditions, like I think everything website these days you have to. Um, and then you select the exact drug or active ingredients in the search results that you're looking for, and then you can view the actual status of the drug, whether it's banned in sport or in competition, out of competition, or both. I find this site super helpful as a healthcare provider. It also allows me to see alternative medications that may be available that are not prohibited substances. Um, Global GRO is available for certain countries such as the US, Australia, the UK, Japan, and New Zealand. So make sure you also look at your National Anti-Doping Authority to see if there's additional prohibited rules. Nilham, any parting words or anything we missed on this podcast on TUEs?
Well, from a recent case in Turkey, from a Turkish athlete, wrestler, tested positive for trimetazidine, and he published a statement that he has consulted to his physician, which was not a sports physician, and the physician has okayed the athlete to use the substance. And unfortunately, the athlete tested positive, and he will not be competing in Paris. It was just a few days before the competition.
Oh, wow.
Of course, this is still being analyzed, and they are going to the CAS for analyzing the situation and proving that maybe it was an unintentional use. We're going to see that. But what I can say is that athletes should not also assume that the most healthcare professionals do not fully understand the anti-doping related matters pertaining to their level of competition, anti-doping organization, or specific of banned substances. So it's always the responsibility of the athlete, and then make sure you consult to experts in the area such as sports physicians, sports pharmacists. So that's one message I really wanted to give to our listeners. What about
Yeah.
you?
I would say kind of in the same idea is that as an athlete, you are ultimately responsible for what's put in your body and upholding clean sport. And we do see this often as the athlete is the one that's always punished, even though somebody may have given them the medication knowing or unknowingly. So it is definitely important that you as the athlete are ultimately responsible. Um, and definitely you need to make to inform your physicians, your pharmacists that you are an athlete, you are drug tested, and most physicians and pharmacists should go ahead and look that up and try and help you make sure you understand the situation that you're in and the medication. So I think those are probably three good points we brought up that, make sure you understand that not all healthcare providers know what's on the list, that you're responsible as an athlete, and that you can work with your physician or pharmacist to understand this and your options of medications.
Yeah.
So I think it's a really good podcast and definitely a good topic to highlight to our athletes and to our healthcare providers.
Yeah, we really hope that this episode gives a helpful overview on how elite athletes are being treated through the TUEs and how the TUE system will work in Paris 24.
Yeah. We look forward to the coming weeks of observing the world's greatest athletes coming together. I love the Olympics and especially the values of Olympics that are excellence, friendship, and respect. I think it's so cool to see the world come together for at least 4 weeks out of the year.
Yeah, indeed. I'm super excited, and we would like you to stay tuned for more on our special Paris 2024 episodes. And let us know what you would like to hear in the coming episodes in the Q&A or the comment section, according to the platform you connect to us. And let's wrap up with our final words. We are sports pharmacists. Our mission is to provide accurate and evidence-based information to optimize your health and performance. When it comes to your health and well-being choices, especially if you're a professional athlete, consult with your physician, pharmacist, or sports physician or sports pharmacist. You should prioritize your safety and always make informed decisions. Thank you for joining us today on the Performance Prescription Lab podcast. We look forward to sharing more valuable scientific and actionable insights in our next episode.